Namaste. Good morning, good afternoon, good evening, depending on which part of the world you live in. Thank you for joining us online. On behalf of UCLAN, UNICEF, and Fernandez Hospital Educational and Research Foundation, I welcome you to the 15th International Normal Labor and Birth Research Conference, being held as a virtual event for the first time. This conference series began in 2002, founded by Professor Soudown and a small group of committed people. Today, we recognize it as a prestigious global midwifery conference. In December 2018, the Government of India made a public commitment to promoting and establishing midwifery as a definite step in helping to reduce unnecessary interventions, including cesarean sections, and ensuring respectful, compassionate, woman-centered care. We're all aware during this global pandemic, birthing women have experienced a variety of challenges, from discrimination, disrespect, and sadly, in some cases, have been offered no care at all. Healthcare professionals have been struggling to find that balance between following protocols that changed so rapidly and trying to keep birth as normal as possible. This is why we chose pandemic, pregnancy, positive birth as the theme for this conference. I'd like to express my sincere gratitude to UNICEF for their unconditional support in partnering with us to host this conference. It encouraged us to offer registrations free, though it was mandatory. Our objective was to make this conference accessible to every level of healthcare professional involved in labor and birth, and those who were interested in research surrounding it. We were overwhelmed by the response. We had more than 3,500 registrations very quickly, representing 87 countries. Dr. Jyoti Unni, my trusted colleague, fellow obstetrician and gynecologist, worked with an interesting mix of obstetricians and midwives in true collaborative fashion. Jyoti had us on an electronic leash helped by Zoom and WhatsApp. Professor Soudown and the Global Steering Committee became our sounding board and support. I'd like to thank every speaker, every chairperson, reviewers of 210 abstracts, judges of oral and paper presentation for their commitment and support despite working through deadlines and inconvenient time zones. A big thank you to our tech team that gave us 24/7 support. At this moment, I'd like to remember our colleagues who have lost their lives to COVID-19. We pay tribute to them and acknowledge their sacrifice with mixed emotions of sadness and gratitude. Finally, on behalf of every member of the organizing team, I wish to say, sit back and enjoy the conference. Use the virtual platform to engage in discussions, ask questions, and forge new friendships. Thank you. I now request Professor Soudown to share her introductory remarks.